Age remains the single largest risk factor for the development of cancer. And when you see a statistic like that, you really have to ask the question, what is it about aging that contributes to tumor progression? So we work on breast cancer, and our focus has really been on the non-tumor cells, the cells that are there to support the growth of these incipient tumor cells. What are they doing? How are they changing with age? And how do those changes contribute to progression and eventual disease? And through this work, we hope to develop better and better therapies to basically stop supporting tumor progression. One of the great things about the American Cancer Society is they fund basic science. We have to understand how things work. We have to build a foundation, and through that foundation, we can use that information to design smarter trials to have a better impact on patient survival. When I was a junior investigator, the American Cancer Society provided funding that allowed me to build a mouse model in which we could look at how aging cells affected breast cancer metastasis. And this was something that was kind of a novel idea when I was starting, and the ACS grant was critical in letting me build this model. What we learned is that non-tumor cells supply critical signals that help tumor progression. And so we've now found drugs that can target that pathway, and we are now moving towards a clinical trial to see whether we can cut the legs out of that support by supplying this drug. You know, I think the onus is on us as researchers not to just let our patients live longer, but to help them live better. And that's actually one of the things we're finding with this drug, that while it limits tumor progression, and that's super important, it seems to do so without as much toxicity as we see with chemotherapy. And so if we can get our patients not just to live longer, but to live better, I see that as a win-win.